Good day, social media family. My name is Dr. Rosemond Abuaji, and I come your way once again with a series on breast cancer. This is the first in the series. And in this episode, we are going to talk about what breast cancer is, what causes it, and the various risk factors to take note of. So normally, just like the way a house is made of bricks or cement blocks, our body is made of cells, every part of our body. And what happens is that because we are living things, these cells have to grow and reproduce themselves. Sometimes some of them die and the new ones replace the dead cells. Every once in a while, some cells begin to divide abnormally. They just get a mind of their own and they grow and divide abnormally. And they form this abnormal mass of tissue that we call tumor. The tumor can be either benign, which means it will not kill you, or it can be malignant, where it can kill you, it can spread to other parts of your body. Breast cancer is a kind of malignant tumor, and it is cancer that starts in the cells of the breast. It is the most common kind of cancer amongst women all over the world. It can affect both men and women, but obviously it is more common in women. The exact cause of breast cancer is not fully understood or known, but researchers have found various risk factors that are associated with the development of breast cancer, and we'll briefly talk about these. The important thing to note about the risk factors is that the fact that you have risk factors does not mean that you are by all means going to get breast cancer. And the converse is also true. The fact that you have little or no risk factors does not mean that you will not get breast cancer. The risk factors for breast cancer can be divided into two: the non-modifiable risk factors and the ones that are modifiable. We are going to begin with the non-modifiable risk factors. Non-modifiable risk factors mean that these are things that you cannot change. They are not related to your environment. They are things about your age, your gender, things that you are born with. So the first example is age. You are more likely to get breast cancer as you grow older. In fact, when I was in med school, I was taught that breast cancer is common in women in their 50s and 60s. But unfortunately, let me say this: I think that the new trend of breast cancer, they've not read the textbooks, because in my practice, I've seen breast cancer in women as young as their 20s and their 30s. But generally, it is true that the risk of breast cancer increases with increasing age. The other non-modifiable risk factor is gender. Women are at a much higher chance of developing breast cancer. The ratio is actually 99 women to 1 man for breast cancer. And this is basically because women are exposed to more levels of estrogen and progesterone compared to men. The next non-modifiable risk factor is early menarche or late menopause. Early menarche in the sense that you have your first period before you hit the age of 12 years, or you attain menopause past the age of 55. And the common denominator with these two risk factors is that your breasts are exposed to estrogen and progesterone for a longer period if you have an early menarche or a late menopause. Family history is the next risk factor, especially in a first degree relative. When we talk about a first degree relative, we are talking about a parent, a sibling, or a child. There are also genetic factors. There are some genetic alterations in certain genes, commonly the BRCA1 and 2 genes. And when you have these abnormalities, your risk of breast cancer is very, very significantly increased. If you have had previous breast cancer, you are more likely, or your risk of getting breast cancer in that same breast or in the opposite breast is higher. If you have had some changes to your breast which have warranted biopsy, and in the biopsy they did not see frank breast cancer, but they saw changes such as atypical ductal hyperplasia, atypical lobular hyperplasia, or lobular carcinoma in situ, these are not frank breast cancer, but these conditions predispose you to developing breast cancer in the future. The next risk factor is radiation exposure, usually for medical reasons. So if earlier in your life you probably had some kind of cancer or any medical conditions that demanded that your chest is irradiated, that increases your chance of getting breast cancer in the future. And then there are a few other hormonal related factors, including never having children or late childbearing, having your children after the age of 30 years. Obesity is also another risk factor. Now we move to the modifiable risk factors, and these include lack of exercise, excessive alcohol consumption, especially when it's done over a long period of time, smoking, and last but not the least, the use of oral contraceptive pills and other hormone related therapies, especially when you use that over a prolonged period of time. You can do something about the modifiable risk factors to help reduce your risk of developing breast cancer. They are not a sure way, but definitely they can reduce your risk. And these include exercising regularly and increasing your physical activity level, limiting your intake of alcohol, quitting smoking, because smoking not only increases your risk of breast cancer, but many other cancers and various other health conditions that we are likely to talk about in subsequent videos. And last but not the least, a healthy diet to prevent obesity and other health related problems. Having more children if you are able to. Now, children are really expensive, not just in terms of finances, but what it takes to raise them. But having more children apparently reduces your risk of getting breast cancer. Breastfeeding your children, it is protective. The longer you breastfeed normally if you are breastfeeding, you don't menstruate, so that is protective. And then you limit the use of oral contraceptive pills and other hormone related therapies. You fall on those options when you have exhausted all your other possibilities. And last but not the least, limiting your exposure to radiation. And nowadays, sometimes it is very easy for a patient to walk in and demand that they want a chest X-ray or they want a chest or abdominal CT. Some of the time, the reasons for which you are asking for these tests are not justifiable. So please, if your doctor or your radiologist tells you that I don't think you need this X-ray or this CT, just bear in mind that it is a way of protecting you from breast cancer or other cancers. Thank you very much. Watch out for subsequent episodes that will delve more into breast cancer. God bless us all.